before I kind of started and just started looking into it, Tonya, I had talked to her, and it just seemed like she was real professional and that they're really serious about, helping their students not only graduate, but to pass the test to move on into a career field. Like, they're really serious. Our T's are very specialized in what they do in the cardiopulmonary system, and so that made me feel, gave me a little bit more pride as far as like, hey, I'm actually getting a good education and getting into a field that's actually kind of, I know in the past it hasn't been so recognized, but I feel like especially after COVID that it's really starting to be more important, more recognized.
Karen, how have the instructors prepared your critical thinking skills?
Our instructors are really good about testing our knowledge, not only in class, but at clinic. They really want to make sure that you are where you need to be and even more than that. It has to be the most exciting for me now. It wasn't at the beginning, but I would say mechanical ventilation. I really enjoy that we have an upper hand. I've noticed that in clinic. I have nurses come and ask me now as a student, what does this mean? Looking at graphic analysis, and it feels really good to be able to teach them, to know that I have the upper hand in that, and it's fascinating. I love it.
Which semester in school did you become a respiratory care technician?
I became a respiratory care technician in November 2021 as a first year. I think that working night shift and my time management skills have been pretty challenging working as a respiratory technician. Being a respiratory care technician through each semester has helped me grow with physician contacts, being able to be comfortable and confident. Therefore, bringing that over into my clinical settings has really helped me and made me a better respiratory care technician.
Okay, I have one more question.
My name is Lina Flores. I graduated last May. I currently work at JPS Hospital in the ICU and emergency department. A few respiratory students came into my microbiology class and talked to me about what a respiratory therapist does, and I was intrigued. I was fully credentialed exactly 1 week later. Even before I walked the stage for graduation, I think everything about the Weatherford Respiratory Program is just a stepping stone to prepare us for the board. So yes, absolutely. So a normal night shift consists of gathering report on my patients from day shift, then obtaining pertinent information about them, like their latest blood gas, their chest x-ray, current vent settings and such. Then I will start first rounds, checking on my most critical patients first, and just kind of doing things in a systematic manner. I typically get an updated blood gas on my patients. Sometimes we transport to CT if needed, and last rounds start at 0300. From there, I finish charting, updating report sheets, and by that time, day shift arrives for handoff.
Director of Clinical Education at South Plains College and for the respiratory program here in Lubbock, Texas. A big believer that a great RT is a patient advocate. They are there bedside, fully understanding what is going on with their patient and advocating for them in whatever facet that may mean. I also believe that a great RT is someone who is an active participant in their care team, whether it be rounding with physicians or interacting with the nursing staff, someone who isn't just going in and doing their job and walking out, but actually part of making sure they fully understand how that patient is and how we can meet the goals for that specific without patient. A doubt. Because from where we are, I've actually worked with other Weatherford, RTs, but being where we're out here in Lubbock, we see students from all sorts of programs, from the New Mexico area, up north, Midwestern, Cisco, all these different schools. And it's such a great opportunity to see all these different programs and how students are. I know for me personally, Weatherford set me up for success in regards to professionalism, how to be comfortable in the industry of healthcare, and talking to doctors, and how to participate in services and different things like that.
Weatherford College Respiratory Care Program Director.
How long have you been the director of the respiratory care program at Weatherford College?
Well, I was one of the original founders in this program when we started in 1998. I have been program director since 2003. Our three main requirements, or our prerequisite courses, are Anatomy and Physiology 1, Anatomy and Physiology 2, and Microbiology. And while those are prerequisite courses, if those are the only courses that a student has completed, they probably will not have as good of a chance as getting accepted. So there are other courses within our curriculum that we strongly urge students to complete. Medical terminology, college English, a humanities and a fine arts credit, and intro to psychology. We do things very differently in our program. Probably one of our biggest strengths is our clinical rotation. We make sure that the instructors that are at clinicals with our students, they're always one of our full-time faculty that are at bedside, and then we make sure that we hire therapists from hospitals that are usually our own graduates oftentimes, or therapists that we know are very, very competent to bring what we are learning in class over to the clinical at bedside patient care. Another thing that we do that's very unique in our profession in general, in the education profession, is that we still allow Zoom to happen. We started Zooming during COVID, and we were very successful with it, so much so in fact that we allow the students now to decide where they want to learn. They can be physically present in the classroom with us face to face, or they can be online via Zoom at the same exact time. And so the student can, if they have a child that is sick or they're not feeling well that day, they're able to still attend class, but just from home. The additional advantage to doing it that way is that we record every single lecture we give, and then the students have a copy of that class session to be able to go back and view as many times as they want to pick up content that they might have missed the first time. So since COVID, the profession has changed quite a bit. COVID was, well, a very challenging experience for all of healthcare. But one of the good things that came out of that for the respiratory care profession is everybody really realized what respiratory therapists were about, what we did, how we contributed. And since then, everybody's learned how valuable we are to the healthcare team. So since COVID, we've had a higher role of autonomy in clinical practice, being part of the healthcare team in the decision-making process. There's a lot of reasons. Obviously, Zoom is a big portion of that, and we've already talked about that. But Weatherford College, we've been here for 25 years. One of the advantages is that myself, I've been here that entire time. Our clinical coordinator has been here, Crystal Brenner. She's been with me for 18 years. And together we've built this curriculum, and we have made changes to it, and we are committed to it. So there's a lot of stability in the faculty. Our third full-time instructor, Samantha Cowling, is actually one of our former graduates. So we work very well together. We have the same belief system. We want to instill that into our students, which transitions to a good respiratory therapist at bedside. Another reason that you should choose respiratory at Weatherford College, we have outstanding pass rates. We really do. We have national pass rates that are over 150% of the national average. So if you get accepted into this program and you make it all the way through the program, we can almost guarantee that you're going to be able to pass your credentialing exam and become a registered respiratory therapist.
What would you say is the best part about your job?
Best part about my job is the students coming through a curriculum that is very rigorous, trying to figure out how everything fits together, because when you first start out in a curriculum, in any healthcare curriculum, you've got a lot of different puzzle pieces and you don't really know how to lock them together. But somewhere along the way, those puzzle pieces start clicking together, and then there are these moments of insight. You can just see the students transform. We call them light bulb moments, where that they are starting to make these connections, and they happen all the time, and it is just a wonderful experience to see the students light up when they finally understand how all these pieces fit together, and they see how far they've come from the very beginning of the program, and to see their confidence in themselves and their assessment skills and their clinical skills, and to see that confidence grow. That's one of the best feelings in the world.